Now, widespread testing has been key in stopping the spread of the coronavirus. But yesterday, the CDC said those who aren't showing symptoms don't need to get tested. Then today, the message changed again. As David Gonzalez explains, the changing recommendations have health experts scratching their heads.
We're still in this pretty awful state.
Dr. Peter Hotez with Baylor College of Medicine is not mincing his words. He says recommendations by the CDC stating asymptomatic people who have been exposed to coronavirus don't need to get tested makes no sense.
We know at least 40%, maybe some say as many as 50% of the cases are without symptoms.
After growing concern over revisions on who should get tested, the CDC backtracked on those new guidelines. The CDC now says everyone should consider testing if they have been exposed to the virus. But Dr. Hotez says the damage has been done.
It's not good that we see these kinds of strong statements then were followed by reversals the next day. And the reason is it undermines trust in our public health institutions.
He says efforts to control the spread of the virus, like contact tracing, would be severely affected if people stopped getting tested. Dr. Hotez praises local health officials for their continued push of the basics, like washing your hands, social distancing, and widespread testing.
Don't get tested immediately within a day because the virus does have to incubate. So the person should get tested within 2 or 3 days after getting exposed.
In Houston, I'm David Gonzalez, KHOU 11 News.